So this first talk is one in a series of seven. This first talk will be focused on the economic benefits of longevity and how proactive health, a proactive approach to health can enhance it, and kind of give a framework about thinking about health like an investment portfolio. The second one, we'll talk about the hallmarks of aging and dive into current evidence on what has been proven in terms of longevity interventions. We think mostly about things such as exercise, sleep, and nutrition, but there are also some more advanced techniques that we can use to kind of push the envelope a little bit. It's important for us to tease out what's proven and what is just hype or unproven. So we make sure that we're focusing our efforts on things that really make a difference and move the needle. The third session dives into metabolic health as an early warning system for chronic disease. We talk about practical nutrition strategies around protein prioritization, polyphenols, intermittent fasting, and help you to evaluate your own nutrition habits. The fourth session talks about exercise. This really is the closest thing to a longevity drug that we have. We'll talk about the importance of balancing strength and endurance training for optimal health and function, and look at some case studies. Like, what does it mean to, what do you need to be doing now to achieve what we call a centenarian level of fitness, meaning a level of fitness that's going to allow you to be functional when you get into your 90s and you're approaching 100 years old. Moving on, we'll talk about sleep as a performance and longevity enhancer, how that impacts stress and chronic inflammation. Move on to medical advances and what may be coming next in the longevity field, what can be harnessed to improve your health. And then lastly, a more hands-on workshop talking about wearables and lab testing and feedback loops and how we utilize that information to make meaningful change. So yeah, your health is your greatest asset. So when you think about the principles of diversification and risk management and long-term growth that apply to your financial portfolio, these really are analogous to your health. Poor health has an impact on productivity, personal expenditures, on medical care. It can shorten careers and detracts from quality of life and enjoyment. Preventative care and longevity interventions directly lead to more years in good health, translates to lower cost of living, and enhanced net worth as a result of being more engaged in all aspects of your life, both personal and professional. So this is one of the key slides in the talk today. So this is talking about the marginal decade and just exactly what your health span is. In this figure on the y-axis is your health, and on the x-axis is age. If you look at the red and yellow lines, these really are suboptimal health trajectories. They indicate functional decline starting about midlife, and that kicks off a period of morbidity. Your lifespan is continuing, but your health is declining, and it's limiting your ability to engage in and enjoy activities that you maybe previously did enjoy. The blue line is the ideal. So that sort of describes a prolonged health span. So optimal health throughout the lifespan until the very end. And then a really compressed period of morbidity. So once you start to get ill, you don't have a prolonged illness. So these lines are modifiable. The trajectory here is modifiable depending on what you do today to take care of your health and well-being. When we think about health span in the United States, well, the average lifespan is 78 years. And on average, about 84% of those 78 years are years spent in good health. If you look at the general population, it seems okay until you think about what actual age that correlates to. And 84% it's 66 years old. That's young. That is far too young to start suffering the consequences of chronic disease or illness that limits your ability to do the things that you enjoy doing. So there's a paradigm shift in medicine. The shift is from a traditional sick care approach to a proactive medicine 3.0 approach. It's a transformative change in the healthcare landscape. This approach focuses on preventing disease before onset and addresses root causes. It utilizes personalized interventions to invest and enhance lifelong, long-term health. So this new paradigm really centers on two key concepts in medicine. The first is lifestyle medicine. And this is really the foundation of like 80% of this project, where you devote 80% of your effort. Without this foundation, all of the advances that we have, the high-tech things that we can implement through longevity medicine are much less effective. So that foundation is key. And then longevity medicine is where the science of medicine can really have an impact. Once you build that foundation of good lifestyle habits, longevity medicine pushes the envelope and helps people excel as they age. So we'll break both of these down a little bit, and we'll first dive into lifestyle medicine just to flesh out what I mean by that. So we think about 6 pillars within lifestyle medicine. The first and most important, along with physical activity, is nutrition. So we promote nutrient-dense, whole food diets that optimize metabolic health, energy, and longevity. Physical activity, including strength training and endurance exercise, are essential for overall fitness, body composition, maintaining mobility, aerobic capacity as we age. Sleep and recovery are the third pillar. Sleep, rest, brain health exercises, these are critical for maintaining cognitive function, emotional balance, and overall well-being. The fourth pillar is stress management. Stress management strategies include mindfulness, meditation, and other relaxation techniques, and these significantly impact long-term health. The fifth pillar is social connectedness. Strong social ties and engaging meaningful relationships enhance overall mental, emotional, and physical health. Lastly, substance use and risk avoidance. Responsible and moderate use of substances such as alcohol and caffeine, as well as avoiding other risky behaviors, prevent negative impacts on health and longevity. So I'll take just a moment and we'll expand on 3 of these, the most important. So nutrition, physical activity, rest, and recovery. So with nutrition, we really think about this as fueling for longevity. Again, focusing on whole nutrient-dense foods, can provide sustained energy, fight afternoon energy crashes. It can have a more profound impact on your health by fighting inflammation. Emphasizing protein, healthy fats, and polyphenol-rich plants is also important. And then there are some other strategies with regard to diet and eating that are worthwhile exploring and considering implementing, things like time-restricted eating windows during the course of the day so that we're not constantly in uh, a condition of surplus energy, because that really is not natural to be always in what we call the fed state. Um, by aligning your diet with your health and performance goals, you really can enhance your vitality, resilience, and your health span. So this is a key pillar of your longevity portfolio. So movement as medicine. This is so important. Um, Exercise has been shown to be the single most effective intervention for improving overall health and longevity. It positively impacts nearly every physiologic system in the body. To build a comprehensive exercise regimen for longevity, we really need to focus on two pillars: strength training to build and maintain muscle mass, bone density, and functional independence, and also endurance training to improve cardiovascular fitness, your aerobic capacity, also known as VO2 max, and your metabolic health. And so rather than just focusing on short-term physique goals per se, I really encourage people to train holistically to optimize the ability to perform key physical tasks required for healthy longevity. So these are things like walking, climbing stairs, balance and simple mobility, the ability to get up off the floor. Now, these don't seem like such monumental tasks when you're young and healthy, but when you're in your 80s or 90s, if you haven't been focusing on physical training, movement as medicine, these things can become really challenging to do and have a really negative impact on your quality of life as you age. So, rest and recovery, these are oftentimes overlooked. I think especially in our culture, we oftentimes think about we should be doing things and be active, be productive. But the reality is that your body heals and makes gains during those restful periods after exercise, for example. So sleep, quality sleep is essential for cognitive function, energy levels, and emotional well-being. It's restorative and rejuvenating for sure, but it's commonly underappreciated in terms of its direct impact on health. When we think about stress and inflammaging, so chronic stress can lead to inflammation, and that accelerates the aging process. That's what we mean by inflammaging. In longevity medicine, we use metrics like cortisol or other stress hormones and heart rate variability. And we track these over time as indicators of stress resilience and help people to make changes in order to better manage that stress. We have objective markers for that. Lastly, thinking about brain health, mind-body practices, meditation, spirituality, social connection, all of these are important for maintaining cognitive function and emotional balance. If you think back to the COVID pandemic, there were so many people who suffered during that period of time due to social isolation, and we saw rates of alcohol and other substance abuse rise, rates of depression rise. So that was an unfortunate example of just how important this is. So moving on from lifestyle medicine to talk about longevity medicine. Like I say, these two are really so interconnected as I'm talking about them separately, I need to make sure that I emphasize that they're interdependent and both essential. So, hallmarks of aging, targeted interventions, having a health investment framework. So, these are sort of the general approach to longevity medicine. We consider what the hallmarks of aging are, and these can be both what you see on the outside, so skin health, physical capacity, um, energy levels, but it's also deeper markers, what we see at the molecular, cellular, and metabolic level, in addition to those functional measures. We try to prevent progression or attenuate those hallmarks of aging with targeted interventions. And then we assess and reassess. The process is iterative and it's continuous, with the idea that if we're not meeting those objectives that we've set out for ourselves, then we reassess what we're doing so that we can achieve those goals. The interventions and the framework that we have for any one person may not be right for another person. It really is personalized and precision. So, the longevity curriculum, I think about this in terms of like, this is what somebody might expect to experience if they come to a longevity clinic. And I think these are all essential components of a person's path. So, what does it look like? We start out on the left of this path um, with extensive screening. Screening for risk factors is essential. Not everybody's risk factors are the same. Some people have genetic risks. We can assess people's epigenetics to look at how those genetics may be manifested. We look at people's metabolic profile. We talk to people about their personal history and their family history to find out what risk may be that we can uncover there. And then we also look at their functional status. If somebody has minimal aerobic capacity or minimal muscle mass, those themselves are risk factors for poor health, and we would intervene there also. The next step is doing extensive early detection and monitoring. So we want to engage in things like whole body MRI to detect occult illness that, before it becomes symptomatic and difficult to treat. We like to use things like liquid biopsies for cancer screening. Some of you may have heard of the Gallery cell-free DNA testing as a screen for cancer. So those are some examples of advanced and less commonly used tools, but we also need to make sure that people are adhering to standard recommended screenings, such as colonoscopies, and perhaps even accelerating the time schedule for such things, rather than spacing them out over a decade, which is oftentimes recommended for colonoscopies. From my perspective, that's too long a period of time, and I recommend screening on a closer interval than that. The next part of this curriculum is metabolic optimization. So we really want to be focused on what's happening to a person's body at the metabolic level. Are they developing any insulin resistance? Do they have type 2 diabetes, or are they pre-diabetic? What can we do to modify that, to optimize their fuel utilization, and to help their body get used to switching between metabolic fuels, burning fats, burning carbohydrates? These are all markers of metabolic health, and they help people to have more energy and to be, overall healthier and feel better. We look at inflammation. So we have markers of inflammation that we commonly check and follow. Inflammation is a risk factor for vascular disease and dementia, among other medical problems. And it really can be optimized through things like diet, exercise, sleep, and medical therapies at times are indicated also, depending on what we think is the underlying cause of that inflammation. So this care is highly personalized, it's precision, and it's tailored to exactly what an individual needs and wants. Um, it's not helpful for me to prescribe an incredibly in-depth program for somebody if they don't have the bandwidth to carry that out. We really need to make it something that is going to optimize somebody's health, but also is something that can be achieved. So all of those things are considered when putting together a management or a treatment plan. And then lastly, this process is ongoing. There's constant reassessment, constant feedback, and iteration of the process. So, what we start out with may not be what we're doing 5 years later or 10 years later. We really need to be adaptive and change what we're doing over time. So, to get into the weeds just a little bit about how we approach longevity medicine, the approach is the term multi-omics is helpful. And so, an analogy is that if you think about a single test that you can do, a blood test or a functional test or whatever, take one test. So that will tell just one page of a story. When we think about multi-omics, we're looking at the whole book, understanding why something is happening at multiple levels and what to do about it. So multi-omics looks at multiple biological layers at once to understand what's driving somebody's phenotype. Phenotype being their symptoms or their performance or illness that's occurring. And it looks at it right now and also helps us to predict what might happen next, thinking about prevention. So when we think about multi-omics, the first layer that we conceptualize is that of genomics or DNA. Then we think about DNA regulation. What is the expression of those genes? Because that can be impacted. Genes can be upregulated and downregulated. That's epigenomics. Then we think about proteomics or proteins. What are the products of those genes? The metabolites, what are the end products of the work that those proteins and enzymes are doing? We think about and then we think about phenomics also. So that is really what is manifested at the functional level. So what is your exercise tolerance? What is your balance? How are you cognitively? How are you emotionally? And so breaking these up into all of these different layers allows us to be much more objective and precise in terms of figuring out what is the problem and how do we solve it. So just to kind of review these omics layers from a different perspective, just to make sure that it's clear. So the genetics or DNA level, the genomics level, really is the blueprint. This tells us what you may be predisposed to, but not definitely what is happening today. Epigenomics is the gene activity. What is your body choosing to do right now with that blueprint? And this is affected by sleep, stress, physical training, illness, diet. Proteomics, again, these are the proteins. These are the molecules that carry out tasks in your body. So this is very close to what's actually going on in the tissues, muscle activity, what's going on in your heart, what's going on in your lungs and your endocrine organs, etc. Metabolomics or metabolites, these are the chemical footprint of your metabolism, what your body is burning, what is producing. This is reflected in things like insulin resistance and energy production and nutritional status. So why use multi-omics? Why take this approach to longevity medicine? Well, it can help us to answer questions like the following. Why am I tired even though my basic labs look normal? Am I truly improving my metabolic health or just moving one number? Or Is my risk coming from more inflammation, insulin resistance, my cholesterol, my stress physiology, or something else? And then lastly, which changes will give me the biggest payoff? Is it improving sleep, nutrition? Is it better physical training or perhaps supplements? Is it medication? These are the questions that we can answer. And so, just an example here. If a goal is, say, to reduce cardiometabolic risk, we might look at somebody's genomics to see, well, what is their inherited risk? Do they have something like a genetic predisposition to elevated cholesterol or cardiovascular disease itself? We might look at the proteomics and say, do you have an elevated level of systemic inflammation that's increasing your cardiovascular risk? From that metabolomics perspective, do you have insulin resistance, and do we need to address that to reduce your risk? And then from a phenomics point of view, what is your VO2 max, and what does your DEXA scan tell us about your body composition and how that impacts your risk? So we can really target these things that are abnormal, come up with a tailored plan of care, and address somebody's overall wellness. So the big benefit is really, instead of guessing, multi-omics lets us be more precise. We can measure, interpret, act, then remeasure and change our interventions, making sure that we find an intervention plan that works. So how do you go about doing this? At the most basic level, it's really defining what your goals are, thinking about where you are now, where you would like to be, and then figuring out how to get there. And oftentimes it's helpful to work with a longevity physician because we can help you with that roadmap to get there, and also help you understand why you might be having difficulty reaching those goals, in addition to uncovering any sort of hidden risks that you might have in addressing those. It's important to measure your baseline at the outset because you want to be able to compare over time if you're actually making gains or not. You build and adjust your plan over time and then commit to consistent execution. And I think this is a really important point, this last one. It's not useful at all to come up with a really aggressive, intensive plan to improve your health if you can't implement it, if it's going to burn you out, if you don't have the bandwidth to carry this on. So it's helpful to have some guidance to, take care of those things that are the low-hanging fruit, the things that are easy to do, and then implement a plan that really works with your lifestyle, your capabilities, and is aligned with your goals. So some key takeaways here. Treat your health like wealth, yes. Manage your health portfolio with the same diligence as your financial portfolio. Think about them as analogous. Prioritize prevention, protection, long-term growth for optimal well-being and prosperity, because that well-being really does impact your prosperity, and prosperity is not just financial. Embrace the paradigm shift from reactive sick care, which is what we have now, generally speaking of the healthcare system, to a proactive next generation 3.0 medicine approach focused on personalized interventions and disease prevention. Leverage the science of longevity, work with a longevity doc, and understand the hallmarks of aging, understand those that you may be experiencing, and then apply targeted interventions to slow that aging process and extend your health span. those years that are lived in good health, and adopt a holistic wellness approach. So really go back to that foundation and integrate those 6 pillars of lifestyle medicine: that nutrition, physical activity, good sleep, stress management, social connectedness, and avoiding excessive substance use and unnecessary risk to really achieve comprehensive well-being. So what's the path forward? Investing in your health, it's akin to managing a diversified financial portfolio. Just as that balanced investment strategy is crucial for long-term financial well-being, a proactive approach to health optimization can yield remarkable returns in the form of increased productivity, reduced medical costs, and a more fulfilling and vibrant life. So, well, thanks very much for your attention there, for your time. Let me pull up the chat here, and let's see if we have any questions. Give me just a second to organize here. All right. So, first question. So these items you're talking about are medical tests. Is there something Medicare covers? So my practice and the typical longevity medicine practice don't bill Medicare. They're cash only practices. We don't bill insurance. Most of the diagnostic testing that we have access to is significantly discounted compared to what you would pay if you were to go to a traditional healthcare system. For example, lab tests are a fraction of the cost. At a major medical center, a complete blood count might cost $60, $70. Through my clinic, it's $7 or $8. And so there's not that much of a discrepancy between traditional healthcare and longevity medicine across the board, but that's one example. Oftentimes, the imaging modalities that we use are significantly less expensive also. Next question. How has your definition of a healthy patient evolved over the last few years? Are we looking for the absence of disease or something else? Definitely the idea that health is the absence of disease is archaic. It's not accurate. We want people to be thriving and really living their life to the fullest. We certainly want people to avoid disease, but it doesn't stop there. That's kind of analogous to this idea of our healthcare model right now being really focused on sick care. You get attention from the system when you have an illness. When you're apparently healthy, there's not as much energy devoted towards that. From the longevity medicine point of view, what we want to do is dive really deep, understand what the risks of developing disease later in life are, and address those risks. We also want to screen for markers of early disease and address those as early as possible also. So it's a radically different approach, and one that, quite honestly, my patients find really refreshing. It is not rushed. It's relaxed. It is in depth, and we really try to address the breadth of people's concerns and uncover exactly where there are risks and where their opportunities are. All right. Next question. We've seen so much progress in the last year alone. What's the one area of longevity science that you're most personally excited about in 2026? I think the thing that I'm most excited about is access to longevity medicine. It's the cost is coming down dramatically. It used to be that really the only way to access such care was to have a true concierge physician, and if you didn't have that, you couldn't get the personalized attention that you sought. But now the cost of the clinical care and the cost of the diagnostics is in the realm that really anybody can access it to some degree. And so that's what I'm most excited about. I think in terms of the medical care, the thing that I'm most excited about is cardiovascular risk stratification, and the interventions that we have to really reduce people's risk. We know so much more than we did, a decade ago in terms of what lipids, what cholesterol particles, for example, are the risky ones. Which ones really cause cardiovascular disease? And what are the other factors that contribute to cardiovascular disease? There are new medicines that are coming out in the next year that are going to target some of those molecules that are known to be the leading causes of cardiovascular disease. And I would say for people who are engaged in longevity medicine from a reasonably young age, there's no reason why any of those people should be developing cardiovascular disease. We know the cause, we have the diagnostic capabilities, and we have the interventions to prevent the disease from progressing. And so I think that's probably the area of the medicine that I'm most excited about. Next question. My husband and I spend 6 months a year in Cabo. Do you work with patients long distance? I do. I work with patients across the United States, and there's no reason why that couldn't, right now across the states, there's no reason why that couldn't extend outside of the country. Part of the underlying ethos of my clinic is that I want to make this care as easy and accessible as possible and really reduce the friction that is there. I tried to make myself as accessible as possible, and just make sure that people are getting the care that they need. When people reach out to my clinic, they get me, they don't get a nurse or a secretary. It really is physician to patient communication to ensure that we're achieving all of these kind of lofty goals that I've recommended. Next question. Can you address your view on protein intake, creatine supplements, and totally separate your view of HRV on longevity? So first, protein intake. I think just generally high quality proteins, 1.5 grams to 2 grams per kilo of body weight is ideal. Creatine is, I think, of value. It's of limited value, but it's one of the few supplements that has been shown to have some value. That said, for the person who's not achieving those underlying lifestyle recommendations, exercise, nutrition, sleep, etc., they're not going to see a benefit from creatine. But for those people who are really focused on those things and addressing all the other aspects of their health and well-being, adding in creatine as a supplement can be helpful. HRV and longevity. So I think their heart rate variability is one of many markers of your overall well-being. And so we consider that in the context of all of the other tools that we have to measure somebody's health. But improved HRV certainly would be correlated with improved longevity. Next question. What are your thoughts on stem cell treatments? So when I think about longevity medicine, there are a tremendous number of offerings out there. There are interventions and treatments that are clearly helpful. There are those that we are pretty sure are helpful, but have not been subjected to randomized controlled trials like in the traditional healthcare system. Those sorts of studies are very difficult to do. And quite honestly, for a lot of the longevity interventions that we promote, they're not going to be done. I mean, the idea of doing randomized controlled experiments over long periods of time regarding the benefits and harms of sleep versus sleep deprivation, or exercise versus or active versus sedentary lifestyle. So we're promoting these things because we're quite certain that they're helpful, but we don't have that same level of evidence per se. But it just makes common sense that we would support those things. But then when it gets to some of the more high-tech areas, things like stem cell treatments, I have a lot of pause. I don't think that they are ready for prime time. I think they're expensive. I think they have some risk. And I think that there are plenty of easier, less risky, less controversial approaches to health and longevity that people can take advantage of. Next, would you agree or disagree that many of today's health issues revolve around diet and specifically the amount of processed food people eat? I do. Diet is essential. So I would say of the sort of those pillars of lifestyle medicine that I was talking about earlier, the two most important are exercise and nutrition. And neither of which we do very well in this country. When it comes to nutrition, we have a problem with overnutrition now. Malnutrition manifested as overnutrition. We don't get the high quality nutrients that we need, yet we have caloric excess. And a lot of the highly processed foods that we have available to us are highly palatable, and are, because of that, they're hard to eat small quantities of them. They're not really satiating, but they're very salty, they're very sweet. They trigger glucose spikes and insulin spikes, and it's like a feed-forward problem where you start eating that way, you want to eat more of those sorts of foods. They're calorically dense, nutritionally poor. And the other problem is that we are living in an environment where there's just a surplus of food everywhere. There's a vending machine at every turn. There's fast food, on every corner. And the idea of like actually being hungry is, foreign to a lot of people. And sort of mimicking that fasted then fed state and switching back and forth is a valuable goal in terms of optimizing your metabolic health. Next question. What is one common piece of health advice that was standard 5 years ago, but that the longevity community is now starting to move away from in 2026? Ah, I think I would go back to the example of lipids. I think this is of such importance that I think I can frame it as a response to this question. So, traditionally, and even now, in the traditional healthcare system, you will oftentimes just get a standard lipid panel drawn. So, your HDL, LDL, triglycerides, et cetera. So, it's a very basic panel. Now, when that was all we had, that was of utility. But now we know that it's inadequate. It doesn't tell us nearly the amount of information that we have uh, uh, access to for relatively little money. These are very easy tests to do. And so oftentimes I'll see patients who in the traditional healthcare system have not had their LP little a, excuse me, or ApoB, which are lipid markers. But they won't have had those checked, and there's no reason for that. And so within, I would say, certainly the longevity community, these are non-stars. These are things that have to be done. And I think that that's starting to take a foothold in traditional medicine, but it's just slowly catching up to it. And I would say within longevity medicine, people who practice in this space tend to be operating just sort of at that sort of leading edge. And I think a responsible physician in this space is going to operate right on that margin, understanding risks and benefits of different modalities that we can use, not reaching into those things that are clearly of questionable utility until there is much more evidence to support those recommendations. So thoughts on use of sauna and cold plunge in healthy aging. So I think there is utility for both of those. Sauna can certainly assist with recovery from activity. With regard to cold plunge, I think this is a really interesting phenomenon. It triggers that stress response within your body in a beneficial way, and so periodic exposure to extreme cold, such as the cold plunge, will kind of help with metabolic flexibility, inflammaging, as a means to augment everything else that you're doing. Again, it's not, I wouldn't utilize that as the kind of the mainstay of your health and longevity program. When you work with your patients long distance, how do you coordinate diagnostic testing? So this is part of what I'm really excited about with the evolution of medicine. All of these diagnostics are so accessible that across the country and even out of the country that I can order laboratory testing or MRI imaging, coronary calcium scores, DEXA scanning, et cetera, from a distance in another state. It's really easy to coordinate these things. What are your thoughts on red light therapy? I think that the evidence is emerging. It's not really robust, but I think there is some evidence that there is utility. with red light therapy, again, as augmenting your overall wellness and longevity plan. I hear fasting is beneficial, but how often and how long? So, my perspective on fasting is that I recommend time restricted eating rather than true fasting, if that makes sense. I think the ideal window, and this can change from person to person depending on their sensitivity to hypoglycemia and other factors. There are other medical problems, but a clear cut window of fasting within 24 hours. So maybe you fast for 12 hours or 16 hours, and your feeding window or the period of time when you eat is restricted to 8 or 12 hours. That allows your body to switch metabolically between the fasting and the fed state. And that is what our body naturally does. More long term fasts. Plenty of people are advocates of that. My concern is that once you get to a certain level of fasted, you're going to move into a starvation mode, and there's the potential for increasing inflammation and stress markers. So I'm more of an advocate of like I say, the time restricted eating as an approach to this. Next, my husband and I receive our HRT pellets at MediSpa in Madison, and I get my microdosing of tirzepatide to reduce inflammation in Cabo. Are you willing to work with other providers? So that's a great question. So I think it's essential for physicians and other healthcare providers to work collaboratively with other physicians and providers. I think it's detrimental to our patients when we're unwilling to have that kind of a collaborative approach. We need to meet patients where they are with what they're comfortable with and with the providers and the approaches that they prefer. So yes, working with other providers is no problem at all. And in fact, if they are bringing something useful to the table, I really encourage it. Well, great. Well, thanks so much, everybody. I really appreciate I really appreciate your time and attention. I think these are really important topics, and wherever you go for your healthcare, I think these are principles that are worthwhile keeping in mind. Um, if you are somebody who's interested in having a longevity medicine physician, I would be thrilled to talk to you and help you explore what that would look like. We're having a grand opening of our new clinic February 1st here in Middleton. We'll be doing a lot of the functional testing and other diagnostics in the clinic, so that will be very convenient. But I can be reached at through my website, by email, or by phone. So thanks very much, everybody. Oh, and here is the website. And there's the website in the chat. And Lastly, there's a phone number to reach me if you're interested. All right. Thanks so much, everybody.